Welcome back. We'll take a little time to have people transition from the rooms.
Yeah, I think there's still folks in the other rooms.
Oh, yeah.
They're closing in 20 seconds.
Okay, I think we've gained most of the participants. Thank you so much for your time. I would like to invite our small working group facilitators to share out just a few words, maybe a minute or two each, around what came forward in the group. And just to say that we will work with our HCSA scribes to get more detailed notes, but just kind of high level, high level. So anybody can start.
Well, I'll jump right in. I want to thank the group that was with Julie and I, and we had additional scribes present, but we came up with, we had actually asked Julie to present, but we came up with such valuable information. And I think, you know, if Julie is on, if you would just chime in real quick and go over 1, 2, 3, 4 as briefly as you can, that would give us great, much more insight. And I don't want to give any misinformation, but we had a great time.
Thanks, Gary. Julie, do you want to just hop in real quick?
Sure. And just super high level here, because we do have a lot of detailed notes. I think in terms of the places where partnerships are needed to deepen, a lot of this was around a number of groups were mentioned. So housing insecure folks, our seniors were mentioned, partly because they don't have access to technology and as much as other people do. So we need to be really mindful of that. There was a strong consensus of meeting people where they are. So needing to get out into the communities to do very intentional outreach, not just handing out flyers. There was really a call for coordination too with the county. So so we don't have gaps. I think there was an expressed interest in doing the analysis of by census tract of where we're reaching, doing outreach, and you know who's doing outreach in what areas, so that we're not doubling up or leaving gaps. That was the first question. And some of the strategies, there's a lot of focus on those one-on-one conversations with people and really getting out to where people go, to the storefronts, the neighborhoods, places where people go naturally, especially for reaching immigrant communities and our communities that speak languages other than English, to go to those locations to reach people. A few good stories were told of models that we could look at, and vaccination success. One of the things that was lifted up that success looks like when no one is afraid, and that you know, there was lifting up equity, that the numbers may look good overall, but we really need to look into pockets of the population that have lower vaccination rates and really keep our equity lens front and center. There was also mention about low-wage workers that don't have access to PPE and wanting to know how the health department can protect them, people in restaurants, people in low-wage industries that need special attention because they're also getting pressured by employers to show up at work sick. So that's something that there's a focus on how the health department can address that. And finally, in the last one, critical messages. Let's see, Gary, I'm going to defer back to you on that because I think people want consistent messaging. That the splitting into different groups for different things at different times is just really confusing the heck out of folks in our communities. And they'd like to see like a consistent story that's told about, you know, wear a mask, wash your hands, have a plan in place for an endemic plan. So when this is just the norm of the land, and then prepare people for surges. So we alert them there's a surge. That means you wear a mask, you wash your hands more often, you keep this social distance. But that's what that consistent and messaging was really important, and not having mixed messages from different places.
Great.
How's
Thank
that,
you.
Gary?
Thank you so much, Julie. That was excellent.
Thank,
We
thank
also
you.
did have in place that we wanted to have PPEs and things of that nature pre-prepared, that if surges come, that community wouldn't have to look for and or be without. So that I don't know if stockpiling would be the correct term, but again, having PPEs and you know, vaccinations and tests, et cetera, in place that would offset having the need for looking. Thank you for my group and my scribes, and we really enjoyed the process.
Thank you so much for that group. I really want to honor that we have 4 minutes left, and I think we have a few more groups to add to the conversation. So if I can ask those groups just to share 1 or 2 things that are different than what you just heard, I would appreciate it. And then we'll go ahead and try to close the meeting close to 7.
Great. I'll go next. Our group was awesome, and thank you so much for participating. Just high level things. We said many of the things that the first group discussed, but some of the things that are different in terms of partnerships. We're looking at our seniors who are both in homes, their own homes, and in facilities, as well as our disability community, and really looking at that lens. In terms of you know, what does success look like? We took a different turn of the question, whether there was vaccination success, and that is if any individual is vaccinated, and if there's parity across ethnic and cultural you know, races. If we look at, you know, 80% vaccination rate, that's across everyone, across the board, not just in certain populations. And then what does success just look like in general of our strategy, not just using vaccination as our primary modality of measuring success. And then also looking at communication. We really were looking at policy, communicating about policy, workers' rights, keeping in touch with, you know, sort of new developments that people may not be aware of that's happening in the world, like Medicaid coming to an end for many populations. So lots of information that people may not get on their own. How can the Public Health Department and HCSA really help to communicate that? And then underlining the word regularly. So regular communication.
Thanks, Dr. Donna. Appreciate that. Dr. Noha, what would you like to add from your group?
Sure. I think a lot of the same things. I think the message needs to be very clear and also nuanced to what people want to hear. So saying strongly recommend might be what the Public Health Department says, but then how are we in community then getting a little more nuances? Do I have to wear the mask? Do I not? Should I wear it? Should I not? And so that even though we're wanting to partner and leverage one another's strengths, you have linguistic, you know, competency in this population. You're a vaccine administrator, and we can connect dots. So it might not be always deepening the partnership, but really doing a better job at coordinating on things like outreach, on things like saying the same message, even in different languages and coming from different people, but the message is just as important as the messenger. Once we are heading into surges, how are we notifying people? How are we alerting people? So how is that getting from the Public Health Department to the rest of us? And then how are we sharing out that information? And a lot like what Dr. Donna just said, what does success look like? There will be no more disparities, and there will be no more COVID deaths. So I think we might not be able to get to 0 COVID cases, but we could get to 0 COVID deaths, and that's what success would really look like.
Great. Thank you so much, Dr. Noha. And just many thanks to our small working group for helping us to build to this conversation. And I would like to invite the small working group to come back and support with the planning for our June meeting. We know that you all are quite busy, and definitely would like to extend that invitation for your partnership as we really move into the criteria for how we make decisions. And I think, Dr. Noha, you said at the top of this meeting, you know, that with limited resources, we really have to be mindful of how we are making the decisions that we're making. So we'll send out a separate email out for that. And I'm going to turn it over to Director Watkins-Tart to close us out. Just thank you all for being here and for participating.
Thank you.
Yeah.
I just want to very briefly just say thank you to everyone for helping to plan the meeting, staff, as well as members of the CAG. Thank you all for staying and participating and giving all of your thoughtful feedback. If there are people who are not in this meeting, or groups or tables that we feel that really have not been adequately represented in this meeting here, please let members of our team know that. We're going to also be looking at the roster for tonight and kind of comparing with the tables that we know already exist to see where there are some big gaps, and we'll be making rounds between now and June to we can't totally recreate this, but to share this information with some other groups who are not here to get their thoughts as well, so that when we go into the June meeting, we have a nice variety of perspectives. And so thank you again, and have a wonderful evening.
Before we leave,
Is that a new hand, Gary? Sorry.
Sorry. Before I'd like to have us really start addressing long-term COVID. There are some symptoms that may be overlooked where individuals may not know that they are covered in terms of, the public health department or insurance. And those are aspects where the community needs to be greatly informed as well. And I think that can be part of our messaging in terms of bringing a new conversation to this vast community that we serve. So just a thought.
No, absolutely. We will add that if it's not already in the suggestions. Thank you, everyone.
Thanks, everybody.
Peace and blessings. Enjoy your evening.
Thank you all. Good night.